You have a few questions written down. Huh.
So like what's the expected healing time, like pre-surgery I can go and brush and all that?
Today.
No, like I'm using like baby brush and all that.
Baby brush is good. Use it for 2 more weeks, 3 more weeks.
Okay.
But you can brush normally. See, the work is happen under. You got to keep the mouth clean. Otherwise, it can get infected. What I told you last time, remember, don't rinse.
Yeah.
Because when you rinse, the pressure increases. So you can brush.
Okay.
It's good. And just gently put water and it might just be a little messy when you do that.
Yeah.
But you should do it. Just keep it down so gravity takes it down away from your body. That's all.
And when will I be in a position to rinse?
Give it 3 weeks.
Okay. Alright.
Same time when you can eat normal food. 15 days to 3 weeks is safer.
Right. So until then, how will be my progress? Like, how would I know? Like now I should chew or?
You know, right? From the date of surgery, 20 days, 15 days. That's all.
That's all.
See, what you have to be alarmed or got to be surprised or you got to be cautious is suppose there's a bleeding, suppose there's any foul smelling, suppose there's some collection, suppose there's any hit, then you have to be worried. Right now it's perfectly fine. There's no swelling, there's nothing happening, no discharge, no collection, no ooze. So it's healing correctly.
Okay. And the same thing, how do I know when to bite? Like, will I be able to assess my own?
You can bite straight away after 3 weeks.
Okay.
Start eating semi-solid raw now itself.
Yeah.
Slowly start off, that's all.
And my brushing routine I can do like twice, thrice a day.
2 times.
Any toothpaste? No. But
No issues. No rinsing, that's all.
Alright. Okay. And like last year I had some frozen shoulder because of winter. So I was asked to go for a massage. So if I get it this year as well, and I'm advised to go for a back massage and all that.
Anything you can do, but should not get this area should not be massaged, and the face should be left free, and no injury. So you lie down like that, not on the chin. You never. I told you this already.
Yes. So for how long I should not do that? Like at least until December?
Yeah, wait for 2-3 months.
Yeah.
Don't injure the chin directly. That's the thing for you because I told you how the plates are.
Yes.
So that you have to be careful. Physical injury, you have to be really careful.
Yeah. And my stitches are from end to end on the jaw.
Yes, they will all dissolve on its own.
Okay.
You don't need.
Sold by what, 3 weeks time or 4?
Usually 3 weeks, but sometimes it can take 4 weeks or even 5 weeks. No issues, but it will dissolve on its own.
Okay. And it will not be like threads coming out and pieces.
Some people do have that happening also. If it comes, do ignore it, throw it out.
Oh.
But mostly you will not know it dissolving. It will just disappear.
Okay. And like we've got like these 5 tablets that we are taking. Now most of them are going to be finished by 7th in like 7 more days.
More than enough.
Okay.
Because in Australia, what happens now, if we need even like amoxicillin, we need to go to the GP. Then
You buy it from here and go away.
Do we need prescription here for amoxicillin?
The same prescription that we've given you. They haven't given you a prescription, they only give you the tablets.
They only give us the tablet.
So they'll give you a prescription, keep it with you.
Okay.
So you can just get that medicine again if needed. You'll not need it though.
Okay.
Any other tablets would we need in between? Like
I don't think so.
assume like next 2 or 3 months?
No,
When
nothing.
We are on our own?
You don't need anything right now also, you're done.
Okay, no painkiller, nothing.
Nothing. Are you taking painkillers right now?
No, whatever you've given me.
Nothing, you'll not have anything more, just relax. Nothing will happen. It'll all heal up.
Just take some extra amoxicillin and that should be good.
Just take a prescription and go, not an extra amoxicillin. Then you can buy it in Mumbai maybe if you need.
Okay.
Alright?
Yeah. So I think I'm going to keep it.
That's it, right?
And then the gel that goes in, will continue to use for some
Use it for a week more. That is a protection that we're giving you before the oral fluids and the food can hit the suture area. That's all.
Okay.
It's a physical barrier.
Right. Yeah.
Alright?
And day before yesterday night I had this like cold and feverish kind of feeling, so I took a Crocin.
Okay.
So if that happens again, I can still take
You
it.
can do that, but it should not happen again and again.
Yeah.
Didn't happen after that, right?
No.
Okay. Shouldn't happen. Drink a lot of fluids, because you are recuperating after the surgery.
Yeah.
Body is weak
Yes.
and you are being put on some diet. So at least you have to take a lot of fluids, especially juices, and otherwise body can feel weak and all that.
And I when I did rhinoplasty, I had a bit of a hump here, and it's almost 3 years now that the hump has disappeared. But whenever I eat, I start getting runny nose sometimes.
May not be because of rhinoplasty. That is some allergic factor that you might have had or something.
Do you think I would have to ever sort of redo a surgery here?
I don't think so.
Because now that hump has disappeared. At the time
Just leave
was
it.
prominent.
No, you can't do a nasal surgery or a rhinoplasty to get rid of your running nose. Nobody on earth can
No, I mean,
guarantee you
sort
that.
of cause and reaction.
It's allergic.
To think,
That's allergic rhinitis. So allergic rhinitis, we don't have a surgical treatment for that at all.
Yeah.
For some patients who have a very severe DNS or a bent septum or a tubular hypertrophy, when you do the rhinoplasty with septoplasty, the allergic component comes down.
Yeah.
But there's no real control over us that we have, So I can say, okay, it might come down.
Yeah.
It will not get worse, we can say for sure. But a lot of patients, it remains.
Yeah.
Because allergic is something that we can't control really. Yeah.
Okay.
So that you probably have an allergy.
And lastly, when in Australia, is there something not right? What would tell me I should go see a doctor?
Anything, fever, bleeding, that's what I said, right? Fever, bleeding.
Okay.
Usually it heals in 2 weeks.
Okay.
Actually now only it's healed. So then nothing should happen, right? Because outer layer is healed. How will it?
Okay.
As long as you take care, nothing should happen from now on.
Yeah.
See, the most important phase is the 24 hours. The next important phase is the first week. Then is the first month. Then is 6 months. So we like to call it primary healing, secondary healing, tertiary healing, like that. So you already cleared the two major times when you can have an issue. That's why we've discharged you, we've done the review, and we're sending it off. As long as now the chance that something goes wrong is like 1 in 500, 1 in 400 types. Very rare.
Yeah.
After a month, it will be 1 in 2000, even rarer. After that, almost no chance. Initially, high chances there. So bleeding can happen 1 in 10 patients after surgery. Then in the next week, it could be 1 in 50, 1 in 40.
Okay.
And it keeps coming down. So you've already cleared all that time. So
Yeah.
as long as you're careful, you're fine.
And then this will start feeling normal in a couple of months.
It will feel normal. It might take a little bit longer in your case because of your age and because of the amount of movements that you've done. So it's a full work.
Yeah.
So, body takes longer to heal. The muscle itself will take 4-5 weeks for it to reattach. So give it some time. Like I said, after a month, you don't have to worry about anything apart from a direct trauma. That's it. And slowly come down. And you will feel as comfortable with your face as you did before surgery in a few months.
Okay.
May not be in 1 month.
Yeah.
But after a month, no one else will know that anything has happened to you in terms of. Now we still know there's something happening.
Yes.
That will not be there after another 2 or 3 more weeks.
Yeah.
Alright? So you people leave tomorrow or today?
We leave to Trivandrum today.
Okay. And then the Thrissur, and then 25th you leave India, isn't it?
29th we leave.
So a lot of time is there. So what you do, even while you're in Mumbai, you can contact us if there's anything. We have your follow-up number here.
Yeah.
So then, just let us know, send some pictures, say we're all fine,
Yes.
finished.
Yeah.
Okay.
Once you go there, also the time difference makes it a little difficult to answer you on time, and then everything gets a little more complicated.
Yeah.
So before you go, you contact us and just tell us how you're doing.
Yes.
On the follow-up number.
Okay.
Yes.
Alright?
Yeah, we have that.
Alright. And yours also, everything is cool.
Yeah.
They've given you the
I have already put that.
Cool. All the instructions have been given. Done. See you both.
Alright. Doctor,
Safe journey.
I just want to thank you.
Oh
and
my
your staff.
God!
Nothing much. Alright. This is my company. So if you want to invest anything in real estate in Sydney, let me know.
Awesome. That's your company. Cool. Move Reality.
Okay.
Oh, I have no budget
No, whenever.
or no plan at the
Are you
moment.
coming up down to Sydney? Let me know.
Yeah, I've just been once to your country. Let's see if I do come again. I'll let you all know.
Take care.
Yeah.
Don't worry. From now you will get many referrals from Sydney.
From Sydney.
Please send across to you. No
Yeah,
problem.
my aunt and uncle, they live in Canberra.
Okay.
And then my cousins, they live in Melbourne. No one lives in Sydney, so we did a trip 3 years ago.
Okay.
So you come to Canberra, you can come to Sydney. It's about 3 hours drive.
Yeah, we landed in Sydney only.
Yeah.
Then we spent a couple of days. They took us around, and we went from there to
Okay.
ACT.
Right, yeah.
All right.
You can take a picture with him.
Yes,
Okay.
that'll be awesome. I'll